Welcome and thanks for joining us on the Flourishing Life Podcast, where we will be discussing what we see on the daily. We're Jackie and Tab from Flourish Medical and Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that will help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tad Tavis and is not intended to diagnose or treat any medical conditions. Please be sure to speak to your healthcare provider for your unique needs. Hey y'all, Jackie and Tad here from Flourish Medical and Wellness, where our priority is listening to you, our patients, and practicing a team approach to foundational wellness for long-term healing. Today we are going to chat with you about one of my favorite things, and that is toxins.
Like Jackie said, today's episode we'll be talking about toxins in detail, and we're going to get into some very commonly asked questions at Flourish. Where toxins come from, what are toxins, why do they matter in our lives? Also, how do you know if you're exposed to toxins? What kind of symptoms can you see? And then what to do about this? What to do if you would have high toxin levels or symptoms of that? So, Jackie, can you tell us what are toxins? How do you define that?
Yeah, so toxins are harmful substances that cause issues in our body, and this can cause a variety of different health concerns, which we'll get into a little bit later. You'll see as we kind of talk through this what that means. And they can have short-term effects, or they can have long-term effects that can really affect your body for many, many years, and some can even lead to pretty serious health conditions like cancers. Some of these toxins are from bacteria. Sometimes toxins can be like poisonous plants or poisonous bites. But the toxins that we're really going to focus on are actually chemical toxins. And these are man-made toxins. They're different chemicals. And we'll touch a little bit on mycotoxins as well, which are toxins that are made from mold from our environment. There are actually over 100,000 chemicals that have been made in the United States and that are used every single day.
Wow. So where are toxins found? And then just let people know how do they get exposed to toxins, or how do they get into a person's body?
Yeah, so some of the most common exposures and where we're going to find them are going to be in our air, our water, so a lot in our environment. These can be in our cosmetics or makeup or personal care products like lotions, soaps, detergents. Very commonly, we see them in lawn care and things that are sprayed for pesticide and herbicide control. They're also commonly found in our food and our food storage containers, so things like plastics, Tupperware, the different types of plastic bottles that we often drink from. They're also found in nonstick cookware. So even though it's a little bit easier to use, it's not a great option when it comes to toxins. And then they're also actually found in things like mattresses and clothing and carpets as well. One of the most common, and what I would say when I've treated patients with this, almost always, I see toxins coming back high from water, which is pretty scary because all of us drink water all day and we need to, but it's a very high exposure to toxins if we're not drinking the right kind of water. In 2024, the EPA found forever chemicals, or PFAS chemicals, in 33% of water systems that were tested, which meant that 70 million people were being exposed to these PFAS chemicals. And this was across all 50 states. So PFAS stands for polyfluoroalkyl substances. And again, these are frequently known as forever chemicals. And the reason for that is it can take hundreds to thousands of years for these chemicals to break down. So for example, if one of these chemicals have what's called a half-life of say 8.5 years, that means that once you've stopped being exposed to it, it'll take 8 to 8.5 years to have half of the amount present in your body. Then after another 8.5 years, you'll have half of that half left, and it just keeps going by half until your body is completely rid of all of that chemical. But that only starts when you're no longer having any exposure. If you were to have some exposure again, that time starts all over. So they're very difficult toxins to get rid of. In 2021, the EPA reported 1.3 million pounds of PFAS chemicals that were waste in the United States. And a lot of these have been linked to cancers, neurodevelopment disorders, and also immune issues, so causing different types of autoimmune conditions.
So when we look at sources of toxins, do we see toxins in our water as well?
Yeah, so PFAS can be found in the water, and then we also have another, usually classified into 4 different types of water toxins. Those are going to be organic, inorganic, biological, and radioactive. So radioactive toxins are going to be things like radium. Your biological toxins are going to be things like parasites or bacteria, which sounds gross, but we actually do have exposure to parasites just from drinking our tap water. And then our organic toxins are going to be things like those pesticides and herbicides that are sprayed and leach into our groundwater and then into our water supply. And then our inorganic contaminants are going to be things like heavy metals, chemicals, arsenic, lead, those types of things.
Okay. So with water supply in mind, everybody wants to know how to have clean water, how to get water, because we need that to survive and function optimally. But how do we get those chemicals out, or how can we make sure that we're getting totally clean water?
Yeah, so that's tough. Unfortunately, there isn't a lot of governmental regulation on our water supply, which may be surprising to you. But local governments are not really required to test for the majority of these contaminants. In fact, out of the 100,000 plus chemicals that there are, they only have to test for about 100 of them to be able to declare your water as safe. And so the best way to get clean water is going to be to drink distilled water. That is the only way to get 99.999% of all of these types of toxins out of your water.
Okay, so what about like household, commercial filters, reverse osmosis? What will those products do for people?
Yeah, so I get this question a lot. I'm sure you do as well. And so what we're seeing with reverse osmosis systems or filtration systems is they're using a physical barrier. And so the issue with that physical barrier is that a lot of times it can break down, it can become clogged, it can have a biofilm that then gets settled next to it, which degrades the quality of the filter, but also could introduce other types of toxins into your water. And these filters, these barriers that are in the filtration system can't really be replaced. You have to replace the entire system. And so oftentimes people think they have clean water when they don't actually have clean water. The difference in that and distilled water is that distilled water is taking boiling water. So the boiling point of all of those toxins that I just mentioned is much higher than that of water. And so as you boil water, or that distilled water evaporates, that water comes to the top, is evaporated off, and then is collected for you to consume, and everything else, because it has a higher boiling point, is still at the bottom or is left because it hasn't evaporated off. So that's the biggest difference between distilled and filtered water. There's no actual barrier that's being disrupted or that can break down over time. You're just getting clean boiled water, basically.
Okay. So with distilled water, if we look at that compared to like a barrier method, all you're getting is that water vapor, no minerals. What do you need to do anything with that? Remineralize the water?
Yeah, so this is also a very common question, and it's very interesting. I think it's a big misconception that we've heard. I've heard, you may have heard it as well. But if you dig into this, really, organic minerals are the minerals that our bodies use. And so when we're looking at minerals, our bodies cannot use inorganic minerals. Our water supply is full of inorganic minerals, which are coming from rocks and soil. Our body can't use this. Think of it as the inactive form. And actually our body has to break that down to get rid of it. It's not bioavailable, so our body cannot use it. In fact, this can actually lead to more issues with things like gallstones or kidney stones. And so we don't want these types of minerals. The minerals that we find in our drinking water aren't great for us. We want to get those organic minerals from our foods, which is what's going to give us the minerals that we need. So there's no need to worry about remineralizing water if you are drinking distilled water.
Okay. So you'd mentioned over 100,000 different chemicals or toxins in this country. I guess where the rubber meets the road, how does that affect us? Do we store them in our bodies? How do they affect our physiologic systems?
Yeah, so they affect our systems in many different ways. And part of this is because we are exposed to them through ingestion, like we talked about with water, also through inhalation, and then also skin contact or absorption. So those are the different ways we can be exposed. And this is important because of the number that we are exposed to on a daily basis. Only 1% of that 100,000 plus chemicals have been tested for safety. So it's a very, very small amount. The majority of these chemicals, we're not even sure how they affect us. There are approximately 10 million tons of toxic chemicals that are released into the environment every single year. Over 2 million of them have been recognized as carcinogens. So 10 million tons being released into our environment every single year here in the United States, and over 2 million have been identified as actual cancer-causing agents. These toxins can be stored in different areas of our body. So this can be in our fat, in our bones, in our liver, in our kidneys, which then can lead to different types of diseases or disease processes. So again, cancer is one outcome that we can see from these toxins. They can be hormone disruptors, so causing reproductive issues, fertility issues. Also looking at, as we age, disrupting our hormones even further. They can be obesogenic, so looking at increasing weight because of the fat, the solubility that they are. They also do contribute to different neurodevelopment issues like ADD, ADHD, autism, those types of things.
So how, with all these different chemicals, these different toxins in water, air, different areas, how does a person know if they've been exposed, what they've been exposed to?
Yeah, so there's a couple ways that I usually tell patients to know if they're exposed. Number one, are you having symptoms? And those symptoms can range from things like fatigue, poor sleep, insomnia, weight gain, brain fog. It can look like eczema or rashes on the skin. You can have GI issues like constipation, diarrhea, heartburn. Headaches is a very common one that we'll see as well. You can also get things like hair loss, joint pain, because of those toxins being stored in the bones and depleting your actual nutrition as well. The other way that you can check for these to know if you have them is to do a test for toxins. And so this test that we specifically will use is called a total toxin panel, and it's a urine test. So you simply take a urine sample, and they're going to test that urine to see what you're actually peeing out of your body. This test will look for mycotoxins or different mold toxins. There's 29 different mycotoxins that are tested for, 20 different heavy metals that are tested for, and then 38 environmental toxins that are tested for. And these are things like your VOCs, your phthalates, your parabens, your phenols, your pesticides, and your herbicides. The really cool thing that I like about these tests is that it's telling us not only what is in your body and how how high that exposure is, but it's also showing us where it's coming from. And a lot of times that's super important because we can help detox and get rid of them. But if we don't know the source and where it's coming from, you're going to continue to have that exposure. So to truly be successful in a good detox, you have to know the source and you have to stop the source first and then go in and get those things out of your system. And so this will tell us, is this a mold coming from food? Is this a mold coming from the environment? Is this a heavy metal that's mostly found in water? So it'll really dive in and explain to us all those things so we can identify the source as well as know how to get rid of it and what we need to be going after.
Absolutely. Thanks for explaining that. So average person, if they want to decrease their toxin burden, decrease their exposure to different chemicals, what are some tangible things that they can do?
Yeah, so top 10 ways to get rid of those things are going to be, number one, I think the most important is look at your water source. And I would really, really encourage everyone to have a water distiller, whether that's a countertop distiller or a whole house distiller for you and your family to drink. That is probably the most important thing and the most common thing that I see where we're getting large amounts of toxin exposure every single day. My Pure Water is a great option for that. They're made here in the United States, actually in Nebraska. Great company. We use them. It's been awesome. Their distiller's been great. So clean water, number one. Scan your product. So there are multiple apps out there, things like EWG, Yucca, Skin Deep. Those are different apps that you can use to scan your detergents, your cosmetics, all of your household items to see what is the actual risk and how high of a toxin load are in those products, and then swap those out for cleaner products. Stainless steel versus nonstick cookware. So if you are still using nonstick cookware, replace that with stainless steel as well as your plastic. So get rid of plastic food containers and switch to all glass. Wi-Fi is another big one. So if you're able to limit your Wi-Fi exposure, your EMF exposure, put your Wi-Fi on a timer so you're not getting that exposure at times you don't need it, that's a really great option. EMF actually increases mold growth by about 400%. So if you're someone who's concerned about mold in your home, that's going to be a really important key for you. Purchasing organic fruits and vegetables is super important. And even some of those processed foods, we'll see a lot of molds and things in there as well. So organic whenever you're able. Air purifier is another really important piece of trying to keep toxins at bay. Air Doctor is a great resource for that. Routine lymphatic massage can really help your body process those toxins a little bit better. 24 to 36 hour fasting can actually help your body detox as well. And then fat loss. So if we're able to lose those fat deposits that are storing our toxins, it's going to help with our overall toxin load. In my opinion, a daily binder is a must. So taking something that's going to bind to those toxins, and I personally think is more important than taking a multivitamin, because even if you're taking a multivitamin but you're full of toxins, your body's not going to absorb that. There are different types of binders out there. My favorite ones are going to be cell core binders like HMET binder, Viride Chem binder, biotoxin binder, and carboxy if you're concerned about mold. Ideally, it's best to just rotate through these. Just take one a day, just preventatively. And then finally, the last piece I think is sauna. So saunaing 3 to 4 times a week, if you're able, for at least 30 minutes, can be another great way to help your body detox these toxins. There is no possible way to live toxin-free and avoid all of them. If you eat, breathe, sleep in your bed, like you're going to have exposures to these things. So we really just have to be supportive of our body getting them out. And if you're having any symptoms, it's worth getting tested so that we can help your body get rid of them.
Awesome. Well, thank you for all the information. Thank you not only for the education on toxins, where we find them in our environment, how we store them, but then also some action items for people too. Anything else that you see regularly with regard to toxins that you want to pass along to people?
I don't think so. Be careful with the distilled water and buying it from plastic. So we do know that people who drink out of plastic water bottles on a regular basis actually consume about a credit card size of microplastics every month. So that's not a great option when we're looking at distilled water. You really need to find some sort of distiller to hook up to your home lines.
Yeah.
So that's it.
Awesome. Well, thank you for the education on all of that. And everyone stay tuned for next month. We'll have more information on a new subject.
See you next time.